Hello and welcome to today's web chat about teens, depression and suicide. Thank you for joining us. My name is Ed. Suicide is the second leading cause of death for young people ages 15 to 19. The constantly changing social media world, round-the-clock access and the threat of cyberbullying leaves many parents uncertain of how to protect their children and safeguard their well-being. Our goal today is to provide some helpful information and answer your questions about supporting your children and their peers, signs to watch for, and what to do if you have concerns about your own child. We'll introduce our panelists in a moment, but first, here's a few housekeeping items. So you can submit questions anytime, even now, for our panelists to answer during the Q&A portion of today's chat. Questions can be submitted in a number of ways. You can comment on this video. Please note that your name or profile name will be visible to others participating. Now, if you prefer a more anonymous option, you can send a private message to us via Facebook, or you can email us at motchildren@umich.edu. That's motchildren@umich.edu. If you can't stay for the whole chat, or you want to share the recording with a friend, a video of the chat in its entirety will be available on our Facebook page later today and posted to the Michigan Medicine YouTube channel soon after that. If you're concerned your child needs immediate support, you may want to consult with your pediatrician about making an appointment with a mental health professional. Children who express significant thoughts of suicide or who are planning a suicide attempt need an immediate evaluation. This may involve your local county's crisis services or local emergency department if necessary. And we have a list of helpful resources available at motchildren.org/webchats. That's motchildren.org/webchats for your convenience. So now I'm going to introduce everybody to our panelists. We have Dr. Polly Gipson, and Clinical Assistant Professor with the U of M Department of Psychiatry. Dr. Gipson's area of expertise is in depression, anxiety, suicide risk assessment and intervention, and trauma and grief. We also have with us Dr. Cynthia Ewell Foster. She's also a clinical assistant professor with the U of M Department of Psychiatry. And Dr. Ewell Foster's work focuses on risk factors for depression and suicide in children and adolescents, intervention and prevention of youth depression and suicide, and evidence-based treatments for depression in children and adolescents. So welcome you two.
Thank you.
We are going to kick things off today with Dr. Gipson. Dr. Gipson, what can you tell us about the prevalence of depression and suicide among our youth and what can be done about it?
So as you mentioned, tragically, teen suicide is the second leading cause of death in our nation. And a national youth risk behavior survey that is conducted annually in our schools found that 17% of teens had seriously considered attempting suicide, and 8% actually made a suicide attempt within the past year.
Wow, well thank you for that overview, Dr. Gipson. So we'll open up the floor for questions now. I'd like to remind the audience once again that you could submit questions by commenting on this video directly. You can also direct message us on Facebook, or you can email us at motchildren@umich.edu. That's motchildren@umich.edu. So we will not use your name when we read off your question, but do know that if you comment directly on this video, your name or profile name will be visible to other participants. So let's kick things off with a question I have here. How do you know the difference between normal teenage behavior and signs of trouble?
I'll start if that's okay. You know, I think that this is a question that we hear a lot from parents, and it's very understandable. You know, I think as parents, we're always watching our kids grow and change, and so change is expected. And that decision point about whether something is normative adolescent development versus this is a marker of concern, I think can be really challenging. So I sort of want to normalize those questions that parents have. But I think some of the things that we ought to be watchful for are really significant changes in kids' behavior or affect. So one of the things that I think can be tricky when teens are struggling with depression is that they're not necessarily presenting as sad and tearful. They're often presenting as really grumpy and irritable and challenging to live with. And so it can be hard for parents to see that as a warning sign for depression. Also, some withdrawal from parents is normal in the teenage years, but when kids really start withdrawing from their friends, their social relationships that they've had for a long time, stepping back from activities that they have loved in the past, that's really a concern. That can be a symptom of what we call anhedonia, and it really just means it's part of the syndrome of depression where things that used to really bring us joy and pleasure don't anymore, so that's a concern. We'll often see kids have changes in their sleep patterns or their appetite, so those are some of sort of the symptom warning signs. Also, if you have a kid that starts having academic challenges, changes in peer group, that type of thing, you want to pay attention. And I think one of the things that we most want to say to folks today is don't worry alone about your kids. Talk with your kids, have an ongoing dialogue about how they're doing, and seek some consultation professionally if you're worried. I always think a parent's gut is a really important piece of the puzzle that all of us in healthcare really need to pay attention to.
Thank you for that. Dr. Gipson, do you have anything?
Yeah, one acronym that I'll add that I think nicely summarizes what Dr. Ewell Foster just shared is for parents and caregivers to try to know the facts. And by facts, I'm talking about their teens' feelings, their actions, their changes, their threats, and their situations of risk. And so that's a way to try to just summarize thinking about the various symptoms and warning signs that were just outlined.
That's a great acronym. Could you repeat that one more time,
Sure.
Dr. Gipson?
So feelings, actions, changes, threats, and situations of risk are the facts.
Thank you so much.
Sure.
That's great.
That is great.
Let's move on to our next question we have here. What should a parent do when a classmate or a friend of their child commits suicide? How do we help our children through something like that?
Yeah, well, unfortunately that's happening all too often. And so I would encourage parents to really talk with school officials to figure out if they have a plan or a protocol for how they might handle these types of situations. Oftentimes they do. They have grief counselors on hand immediately following. They provide a lot of group as well as individual support. So I think as a first step, it would be good to be in touch with school officials to figure out how in their community they're going to handle this death by suicide.
That's good advice, thank you.
Yeah, I would just say that, a death by suicide has, a really deep meaning for the surviving family and for the community. I mean, it's almost, I think about it as it sort of has this, far-arching ripple effect, right, where so many people feel touched by this, and it really has a huge impact in our communities. And unfortunately, in Washtenaw County, we are experiencing more of that now than we would like to. So again, really opening that dialogue as parents and talking with our kids about how they're doing is really very helpful. I completely second what you were saying. Part of what we're trying to do now with our state SAMHSA grant is really assist schools in developing policies and protocols when there is a death so that they can get out in front of it. There are lots of resources, both for schools and parents, on the Suicide Prevention Resource Center website, which I think is on the resource guide that you mentioned at the beginning. But there are fact sheets there about talking with your kids after there's been a death, information resources for schools about how to do this well. So I would encourage you to take advantage of those resources and just keep talking and supporting.
Thank you. That's very good advice. We actually have some questions coming in.
Yeah.
What should a parent do if they see their child cutting themselves? Does that mean they are suicidal?
That's a good question.
Yeah, that is a really good question. We tend to think of that as self-injurious behavior, and we actually know from research that can be a risk factor to an actual suicide attempt. So it is important not to minimize that behavior And I would encourage the parent to talk with their child, to make sure they can talk with their child when they themselves feel calm, and express their concerns, share what you've noticed, and ask some hard questions. And really try to work with your child to think about, what can you do together? Like, as you mentioned, seeing a pediatrician, maybe seeing a mental health provider, but it's definitely something that I wouldn't ignore.
Absolutely. In talking with kids who have engaged in this behavior, they tell us, and research suggests that kids can begin this process of self-injurious behavior as a coping mechanism almost, and often it will happen when kids' own, whatever coping resources they have been exhausted by whatever stressor it is that they're facing. And so their toolbox is empty and they move to this type of behavior. I've had kids say to me that they're in so much psychological distress that nobody can see, and so somehow having a physical referent of that on their body makes, sort of helps them to feel better in some way. Sometimes when kids are really struggling with depression, they report feeling very numb, and that feeling of physical pain, again, can be in some ways internally reinforcing for them. So what we really want to do from a treatment perspective when kids and families share that this is going on is help kids to develop a better, more effective repertoire of coping skills, and that's really what a psychosocial intervention or treatment would do, is to help kids think about what are these stressors, how can we get the environment to help you reduce your stress, how can we help you grow some more skills so that you don't need to do this anymore. So it's important in its own right, even if kids aren't saying, I'm doing this because I want to die. But Polly is absolutely right that we, Dr. Gipson is absolutely right, that we really want to take it seriously, because we know that, as kids start thinking about death and dying as a solution to their problems, this idea of slowly getting more okay with that idea and acquiring a capacity for self-harm is a really important risk factor for suicide. So to the extent that they are injuring themselves, that's helping them get okay with an idea that we don't want them to be okay with.
Thank you both for that. The next question that we have in, how can a grandparent help a granddaughter who attempted suicide?
Yeah, thank you for that question, and I'm sorry to hear about your granddaughter. I would say that you're in an excellent position to work with your granddaughter, because one of the things that we know is this idea of connectedness. And so what that means is the people in our sphere, so to speak, that we feel a sense of belonging, that show us that we matter, they can really serve as to help us and to protect us. And so obviously this grandmother is expressing this idea of feeling connected to her granddaughter and really having a love for her and wanting to be helpful to her. So I think it's important to think about the relationship and to continue to focus on the relationship, to talk with your granddaughter about her struggles if she's willing to share them, and just to remain open and let her know that you're available, that she can reach you, she can contact you, you're a support person, you're rooting for her. I think all of those things go a long way. And I also think it's important to just try to have fun with her. I'm sure you're aware of her interests and things that she likes to do, and maybe you can help to be a facilitator. Get out into your community and get involved in some of those activities or organizations that she might be interested in. That's another type of connectedness that we know helps young people. So I think just really focusing on the relationship and trying to, further foster that, but also think about other connections that you can kind of help her by co-facilitating that process.
So the next question that we have in is, can you discuss the importance of saying died by suicide instead of committed suicide? Committed suicide is an outdated term. If you could share why this is important as the way we talk about suicide changes.
Amen. Thank you for that question, whoever sent that. I'm so glad that you shared that. So we really strongly advocate that people are careful with the language that they use regarding suicide, because of what we were talking about before, about that ripple effect when folks die, and how, how challenging that can be for survivors. So the idea of saying that someone has committed suicide, that term committed has a really negative connotation. People equate that with committing a sin, and by extension, it sort of frames the death in that way, that it was sort of a sinful or shameful act, and that what that does is it can tarnish the memory of a loved one, and it can reduce the support that survivors feel in the aftermath. And so we absolutely encourage you not to use that type of language and to say died by suicide. There are some other terms that we also suggest not be used for similar reasons. So in healthcare settings, for example, people might say, oh, that was a suicidal gesture. And we don't love that term either, because it sort of suggests that that's wasn't a meaningful act. It's a way that sort of undermines the importance of and we always want to take any type of suicidal behavior seriously. So that language is very, very important, and I'm so glad that that someone posted that.
Fantastic. Now, the next question that's come in. If your child is depressed, is it okay to ask them if they're wanting to harm themselves, or is that putting the idea in their head?
Yeah, that's also a really good question. And a lot of times we like to think of that as a myth, and it's really challenging, but we try to work to kind of bust some of these myths. And so what we know is, I think maybe what the person is getting at is, we know that every teen that's depressed is not suicidal. And so obviously that's what makes it tricky. But we also know that asking a young person about whether or not they've thought about suicide, or have made any plans for suicide, actually does not implant the idea. And so it's really important, again, to try as much as possible to stay in that kind of connected relationship with your child or the young person in your life that you care about, so that when you do ask these questions, they know that it's coming from a place of concern. You can even sometimes even kind of suggest, like, that it's a really particular time, a stressful time, or highlight some of the things that you've noticed that are concerning to you. But I think the main point to stress is that asking a young person does not implant the idea.
Thank you for that.
Absolutely. And if I could take the opportunity to add that absolutely we would encourage parents to do this, but part of our larger public health approach to suicide prevention is really training all of us in the community, everyone who interacts with kids, to acquire that skill set. And there is a sort of a type of public health approach that's called Gatekeeper training. And there are different evidence-based training programs that are available in communities to help all of us who interact with kids to feel more comfortable. It can be a tough conversation to have, especially for those of us who aren't trained in mental health. But our pediatricians, our coaches, our faith leaders, folks who work in schools, educators, the list goes on, feeling comfortable knowing what the signs are, how to join with a kid and say, I care about you and I'm concerned and I want to be helpful to you, and are you thinking about hurting yourself? And if they say yes, being able to stay calm and manage that and know how to take the next steps and get a young person to help. But it really is an important way that we can all play a role in suicide prevention in our communities.
Thank you for that, Dr. Ewell Foster. The next question that's come in, and I'm happy to say we're getting quite a few questions in here. Why does it seem that there's more teen suicide now compared to 20 years ago? My daughter knows 4 people who have attempted suicide.
Yeah, that's also a really good question, and I'll try to be brief so that we have an opportunity to answer as many of your questions as we can. Again, there's lots of people in our nation that are researching this and that are looking at this and trying to understand trends and trying to understand why teens the suicide rate is so high. And there's not a simple one answer. There's oftentimes a complex interplay of the environmental factors, factors about the own youth's mental health. There can also be familial factors. You know, oftentimes as I work with young people and really get to know caregivers, we delve deep into family history and we learn that there have been suicides in the family. So there's not one answer as to why, and that, you know, that's also why we have to have a lot of different strategies as to how we approach this, because there's different kind of risk factors, if you will, that impact young people. But to the point that you're making, you know, we are trying to help our media to report on this in a way that prevents a contagion and to not give, you know, so many details, because that could potentially be suggestible to certain young people.
Thank you. Anything to add, Dr. Ewell Foster?
No, not really. I wish we could say that the rates were not increasing. They are increasing, and it's of concern to everyone. And, you know, I think I just want to emphasize that mental health is not the solution. We need a large, comprehensive public health approach that includes prevention all the way down to what are we doing in our young children to promote wellness and resiliency and good health. You know, this isn't a solution that is going to, you know, just adding more mental health professionals at the end of that continuum is not what we need to do to solve this problem. We need to go way back. Prevent.
Thank you.
Mm-hmm.
The next question we have, is there any way to prevent teen depression? What can we do to make sure our children are mentally healthy? That kind of ties in nicely.
Yeah, that's a good one. Well, I mean, I think we all have lots of ideas about that, but you know, the interesting thing, we're talking about depression and suicide today. I think, you know, I would argue that there are a lot of shared risk factors, and things that we know that would prevent depression and suicide are also going to prevent a host of other adverse outcomes for kids. So substance abuse and teenage pregnancy and school dropout and juvenile justice involvement and those types of things. But you know, if you go really far back to the beginning, it's supporting parents and young people, right? It's preventing child abuse. It's giving families resources that they need to learn parenting skills. It's having our schools have the resources to do social emotional learning and coping skill acquisition for kids, anti-bullying programs in schools. So really that, you know, that primary prevention, universal prevention idea. So I hope we can all advocate for those things. What else would you add?
Yeah, well, that's a pretty, you know, long list.
Yeah.
I don't know that I would add anything. I think I would just maybe say, you know, just to kind of think about what do all of our kids need. Mm-hmm. And as I mentioned before, you know, kids need attachment and that sense of belonging. Mm-hmm. Kids need what we kind of consider a sense of competency, meaning that they know that they can do something well, mm-hmm. and, you know, to try to help them with that, because oftentimes kids struggle academically. And, you know, I think just thinking about some of those strategies, and connectedness obviously is a part of attachment. So just, you know, trying to summarize it a little bit, but, you know, just thinking about what are things that you can do. So oftentimes I tell parents to think about their toddlers, and things that we did to help our toddlers, those are the same things that our teens need, and not to forget that, you know.
Thank you. That sounds like great advice. The next question I have for you, it's interesting, we're on social media now, on Facebook Live. What should you do if you or your child sees a friend post something on social media that feels like he or she may be suicidal?
Yeah, we've been getting this question quite a bit. I'm thankful that you asked it. So I think the main thing that I try to tell young people is to try to tell an adult, because, you know, oftentimes young people, they're in the know. You know, they know what's going on a lot, and things are passing around on social media. But it's kind of staying within the peer group and these peer networks, and it's not quite getting to an adult who can maybe take action. So I would just try to encourage them to tell an adult, because while their friends may be well-meaning, it can be challenging, even for us as adults, to know what to do. So imagine for peers. So I would encourage them to tell an adult that they trust in their community, their school, or even their parent, so that somebody can try to, you know, save a life potentially.
I also want to put a plug in within Michigan, so I'm guessing there are some folks viewing who are not in Michigan, but within Michigan there's a program called OK to Say, and it's run by our state attorney general's office, and it's publicized in lots of middle schools and high schools across the state, but you could just Google OK to Say, and it gives kids a confidential tip line where they can call and seek assistance for someone that they're worried about. So that's a wonderful resource that we have in our state. And I would also offer that a number of social media companies are actively working with the suicide prevention community to think about how their platforms can be a force for good. So Facebook, for example, has a number of sort of reporting features where if someone makes a concerning post on Facebook, you can privately message them or get some consultation, access to the Lifeline, the Suicide Prevention Lifeline. So those resources are good to know about as well.
Thank you very much for that. The next question we have, we're moving from social media to TV, the 13 Reasons Why program on TV. How can a family protest its showing to teens?
Yeah, it's really challenging. I mean, I'm aware that there have been a lot of grassroots movements within the past year to try to educate and even prevent. I'm not sure how successful those have been. I know it was renewed for a second season. So it's a really hard question, but I do think advocacy is important, and it is important for parents and caregivers to be able to voice their concerns and join efforts that they believe in. And while we might not get the outcome that we want, maybe it helps us along the path of positive change. Maybe it provides an opportunity for you to talk with your teen about something that maybe you otherwise wouldn't. So I don't know if you have more to add, but those are my thoughts.
Yeah, I would agree that I think the mental health community, the suicide prevention community, was fairly concerned about that program. Again, on the Suicide Prevention Resource Center, there are some links to really good discussion guides for parents to follow with their kids in talking about this. We actually here at Michigan are investigating, kids watching of that show and the way that it may or may not have impacted their mood. These are kids who are coming into our psych emergency services here. So that's a study that's ongoing, and we hope that it will help the advocacy and those concerns. But we do keep emphasizing, start the dialogue. Just don't be afraid to have the conversation.
Thank you. So we're about halfway through our Facebook Live right now. I'd just like to remind the audience one more time that you can submit questions by commenting on this video directly, by direct messaging us on Facebook, or by emailing us at motchildren@umich.edu. That's motchildren@umich.edu. So let's move on to our next question. Can you speak to the effect on rewards-based systems in our schools and adolescent depression? Should we stop the punishment by rewards or make our children suffer through using coping skills?
That's an interesting question. I'm not sure I fully understand the question or where it's coming from, but I will say that we know that praise and positive attention is a wonderful motivator for kids. It's a way, in our young children, as they're learning to engage in the behaviors that we want to see as parents, that we can really teach them that they're doing well and builds their self-esteem and their self-efficacy. So I'm a big fan of using positive rewards, but I'm not sure I fully understand the question.
Just to add to that, I think what they maybe are getting at, and I hope I'm not misunderstanding either, is just this idea of, when kids are younger, we have to do a lot of what we call external motivation. And oftentimes in schools, there's a color system, there's a chart, you're earning points, you're working towards certain things, a class trip, and like they mentioned, there can be punishments, you have to miss, recess and those kinds of things. And so I think what they're suggesting is that maybe some of these programs are still happening in adolescence. And so my thought is that, adolescence, there's a lot of kind of developmental milestones that we're helping our young people to meet. And one of them is to try to turn that external motivation to more internal or intrinsic motivation, where the hope is that the young person will become more motivated internally because of their goals and because of their values. And so, I'm not for sure, but it could be that maybe the school somehow is seeing that their students aren't as intrinsically motivated, and so maybe they're trying to develop some of these kinds of programs to try to help that motivation. But it can be challenging because we know that if there is something that a young person is already motivated to do, we don't want to necessarily reward it. There's some good, research on that even in young kids. So again, I'm not sure if I fully understand it, but I hope between the both of us we've at least shed some we shed some light on it.
Yeah.
I think you did.
Praise
I think
good.
you did.
Yeah.
So next question, it's becoming common lingo amongst teens to say things like, I'm going to kill myself, or I'm jumping off the bridge. So it becomes difficult to know if it's a method of venting or of actual concern.
Yeah, it is really hard and challenging, to keep up with the lingo and to keep up with everything that's going on. But one thing that I always try to advise parents and caregivers is to think about the way that young people communicate. So to me, young people communicate a lot through their behaviors, and they sometimes even communicate in the way that they use humor. And so I think that while it's difficult to know, it still provides an opportunity for dialogue and to have a conversation and to try to understand, if they keep using language that you find concerning, what's kind of the meaning behind it for them? Mm-hmm. And is it something that they're just repeating because that's kind of the end thing to say, or are they feeling taxed and stressed and overwhelmed? And even if they don't mean it literally, it's important to know that they feel like their coping resources have been exceeded and they're maybe running out of strategies of how to manage their stress.
Thank you.
Yep.
The next question we have, how do we help our children facing depression over a friend's attempted suicide?
This really goes back to what Dr. Gipson was saying earlier about friends being in the know, wanting to be good friends to each other, but sort of the limit of what you can do as a young person to provide support. So I do worry about that, and of course we all want our kids to be good friends and to be supports for one another. But I think as parents and as caregivers, it's really important to help kids have boundaries and know, there's a line between which, that you're supporting a friend, and then when it crosses the line so that it's really harming you, that's really when an adult needs to get involved. And so maybe it's that this young person is leaning on a friend because they're not in care, or they haven't talked to their parents, or adults haven't been appropriately notified. So it's, we want to hope to get that person who's hurting the care and the support that they need. That's a tough situation. We hope that all of our kids are surrounded by caring adults who, when they know, they can move forward and help.
If I may, I just want to add a little bit to that. I direct our trauma and grief clinic here at Michigan Medicine, and we do at times see kids that are coming in because a peer has died by suicide. And so there is a such thing as traumatic grief. So we know that when a young person experiences a death, there is a bereavement process. There is a normative mourning process that happens. But sometimes it can cross over into the realm of what we call a traumatic grief, where their bereavement and their mourning has, again, exceeded their coping capacity, and they themselves are having difficulty functioning. It's impairing their lives, which I think is what you were mentioning. So I think what I would suggest is kind of how we talked about being on the lookout for changes. If you know that this has happened to your child, talk with them about it. Think about ways that they're coping. Think about ways they can memorialize their friend, interface with the school. But if you feel like, by your own kind of family standards or your own norms that it seems to go above and beyond that, it might not be a bad idea to get an evaluation for them just to make sure they're not experiencing a traumatic grief reaction.
Thank you.
Great point.
The next question we have, what signs are there to help you know when a teen is briefly thinking about suicide versus actually planning one?
That's a great Well, this is. I'm not sure I'm going to answer the question, but I'm going to take the opportunity. You know, thinking about suicide is absolutely a risk factor for suicide, and we want to pay attention to that. But if you look at the data in terms of you know, the prevalence rates of death by suicide, right? So we know that girls are reporting more ideation than boys. We know that girls are making more attempts than boys. But if you look at who's actually dying by suicide, it's our males. And so I worry that when we define risk and we decide to start taking action just because somebody reports a thought, that we are missing some of these, you know, men who are and younger males who, you know, have significant risk factors, but they're not presenting in that way. You know, they're not talking about it in that way. They don't think about it or experience it in that way. So, you know, so I worry about that. You know, and it really just sort of goes back to having that conversation. We know from our YRBS data that Polly was mentioning at the beginning of our hour that there is a large chunk of young people in this country that are seriously thinking about suicide. And that's important. There is a smaller number that will actually go on to engage in risk behaviors, but it doesn't mean that it's not important that they're thinking about it. So, you know, I think, you know, if kids are considering coping in this way, that they're telling you, they're communicating with you that they need something to happen to support them. So, you know, we always want to take that seriously. But thanks for letting me make my pitch that thoughts are not the only thing we need to be paying attention to.
Thank you. So the next question we have, and we've touched on this a little bit already, what can a parent do if your child has depression and has withdrawn from socializing? It's difficult to push a child to do things that they don't want to do, especially when they're teens.
Yes,
Amen.
Thank you for that question. I think that if you know that your child has depression, it would be very important to make sure that he or she is receiving treatment, and ideally an evidence-based treatment. So as a clinical psychologist, we know that cognitive behavioral interventions is one of the gold standard treatments. And so it would be important to make sure they're connected for treatment and that their provider is working from an evidence base. There are other evidence-based treatments as well, and maybe we can provide a link to that on our resources at the end. And sometimes there's even pharmacological intervention that might be involved as well, and using kind of that combination. But as this person is mentioning, one aspect of that treatment is this, what we call behavioral activation or activity scheduling, and trying to help the young person to get more active and get more engaged. And I oftentimes work with my patients around starting small and thinking about, as you mentioned, they might not want to leave the home just yet. So thinking about what at home can they do that serves to be kind of a boost, mood boost motivator, that they could do, you know, at least once a day, doesn't take a lot of time. And so sometimes you have to kind of start small and go for the small wins. And so it is okay if initially they're trying to do some things at home that might elevate their mood. But I think the main thing I want to say here is that to take a team approach and to make sure they're in treatment and that you're not, as a parent, trying to do all of this on your own, because it's very difficult.
Anything to add?
I think it's very well covered, yeah.
The next question we have in, we lost our 16-year-old nephew this summer, and it was hard to have that conversation with our 14-year-old and 11-year-old children. Do we continue this talk as they grow? It's so hard to know if they want to talk about it more or if they're tired of it. I feel like it's me dwelling on it more than what they want to hear.
That's so hard. I'm hoping maybe you'll take this one just with your, you know, trauma and grief.
You know, yeah, that's fine. So first of all, you know, my condolences for your loss, and as you kind of allude to in your question, it is a lifelong process of losing somebody to suicide and coming to terms with that, and the way that you make meaning of that, it changes as we develop in our lives. And so I think, you know, I understand your point, but I also think it's important that you are continuing to kind of what we call co-facilitate the bereavement or the grief whatever your children might be experiencing. We know that oftentimes they don't volunteer that information. Sometimes they might be experiencing their own kind of reactions, their own thoughts and feelings about it, if you will, but they're nervous to share it because they feel like it impacts the family in a certain way, or they don't want to upset, other people within the family system. So I think having check-ins is important. And I also think it's important to be mindful of maybe special anniversaries or dates, the nephew's birthday. What might be, or if there were gatherings around the holidays, what might be some particular times that there was interaction with this nephew in your family, and how can that be acknowledged? And so it doesn't always have to be a check-in about something being negative. It might just be, how are we going to honor this person? Do we want to have a seat at the table? Things like that. So those are just some ideas of how you can not necessarily check in about them having a negative reaction, but also to have some positive and fond remembering of his life.
Thank you for that. It's fantastic.
I'll just add, if I may, that was beautifully addressed. There are, I think often we hear from young people that if they are struggling, they will have a concern about sharing that, especially if they are concerned about their parents' well-being. Right? They're concerned that if they open up the conversation, if the young person opens up the conversation, they're going to make their parent feel sad. And so I think that's just an important thing to remember, that as parents, we are helping our children when we take care of our own grief process or our own well-being. And so, to the extent that these resources might be helpful, there are in many communities survivors of suicide groups. There are some here in Ann Arbor, the American Foundation for Suicide Prevention, and I believe the American Association of Suicidology also has lists where you can link up with survivors groups, and that's just can be a really helpful community to align with. It's a unique grief.
Mm-hmm. Thank you. The next one is a question asking, do you offer or do you have any recommendations on outreach programs that can help school social workers?
Oh, I'm so glad you asked. Yes. So again, the American Association of Suicidology offers a training for school mental health professionals around suicide risk. There are a number of toolkits on the Suicide Prevention Resource Center meant for school mental health professionals. Here in Ann Arbor, there really are wonderful resources, sponsored by the Depression Center, sponsored by our state suicide prevention grant. We also have a University of Michigan campus grant right now that sponsors a couple of trainings every year around both clinical skills for assessing and managing suicide risk, as well as advanced Gatekeeper training skills. So I would encourage folks to take advantage of those trainings.
Thank you. Next question we have in, how do I help my daughter deal with family members that truly don't believe that kids can have depression and anxiety?
Yeah, that's a hard one. And, it kind of gets back to this idea that I spoke to before about a myth buster, and historically we had that belief, and that gets passed on. But I think I'm going to just pivot on it just a little bit, because it's very hard to change another person, to change their beliefs. And so I think what's most important is just to continue to validate and affirm your child that you believe her, and that whoever's in your kind of close-knit family are her kind of cheerleaders and champions to kind of fight this with her. I always talk about it with families in the context of if a child had cancer. Most families I know, if their child has pediatric cancer, it's like the family is going to battle, and they're going to fight cancer. And I like for families to think about mental health diagnoses in the same way. So I think it's important to focus on the positives and to focus on who is with her and who's fighting with her.
Thank you for that. Thank you. So the next question, and I'm very grateful for all these questions coming in. My 13-year-old granddaughter is in treatment, working with school counsellors as well, but is falling behind in school and doesn't seem to want to put the effort needed into the plans made by the therapist and counsellors. How can I help?
You know, this is challenging. You know, as we mentioned at the beginning of the hour, often kids start to show us their distress by a decrease in academic functioning. It's pretty hard to be depressed and not have impact on your academics. If you just sort of look at the constellation of symptoms, they're not sleeping well, they're fatigued, they have concentration difficulties, they're not experiencing pleasure, you know, at school or in that sense of accomplishment that you might have when you get your homework finished, you do well on a test. So it's really tough, especially, you know, our teens often have a lot of difficulty with sleep. They have difficulty falling asleep, or they're waking up in the middle of the night. So getting up and getting to school at 6:30, 7 o'clock in the morning, it's really hard for a lot of our teens. You know, if the depression is you know, that's significant, obviously the first step is to be sure that she's in an adequate, you know, care program, and that you've got psychosocial intervention, evidence-based therapy, and that you've, you know, considering working with a psychiatrist also for a severe depression. That combination treatment, as Dr. Gipson was mentioning, is our best bet. But beyond that, you know, I often as a clinician see that it's my job to be connecting with schools and to be sure that schools are aware of what this young person is struggling with, and specifically how they can be helpful. So, you know, for example, I might try to negotiate some accommodations for the young person at school. So maybe they'll have a reduced class schedule if sleep is an issue and getting there for first period is hard, and they're going to finish up that class in summer school or online or something like that. Sometimes shrinking the to-do list can be very helpful. It prevents overwhelm in our young people. It lets them do a smaller amount of things well, and that can really be a helpful part of treatment. But our colleagues in schools often share that they want to be more involved in the mental health treatment team. And as someone who trains new clinicians here, and I know you do this as well, we really try to instill that idea that if you're going to work with kids, you need to work with schools too. And we're all a team, and kids are spending a lot of their day with our school education colleagues, and feeling like we're all a part of the same team is really important for kids' prognosis and well-being.
That kind of ties into what Dr. Gipson was saying about everybody going to battle and a strong support system. So we've touched on this before, but I think it's definitely worth touching on every question we get. As a parent, how do you know where the line is between normal teen moodiness and needing professional help for depression?
Yeah, as you said, we spoke about that briefly before, and so I think what I would just say is that it doesn't hurt to get a checkup. It doesn't help to go in for an evaluation. I wouldn't want to burden the parent to be a mental health professional when you're not. So I would say that as you've listened to us talk this afternoon, if you're kind of shifting through your kind of clues, if you're like putting together a puzzle, and you're really realizing that your concern meter is higher than your unconcerned meter, then it doesn't help. It doesn't hurt to go to the pediatrician or to go see someone else in your community just to get a checkup. We do that for our physical health, and it doesn't hurt to do that for our emotional health. And it can be framed to the young person in that way too. We're just going to go see. We're just getting a checkup.
Thank you. How can I tell the difference? This is our next question. How can I tell the difference between a serious threat and an empty threat when I hear my nephew contemplating a suicide attempt? It's another one that we've touched on a little bit before.
Yeah, I want to say that I understand where this writer is coming from, and that sense of not knowing. My rule of thumb is always, it is better safe than sorry. And I just don't ascribe to the notion that there is such a thing as an empty threat. I think we need to tell our kids that we take every clue about their well-being seriously. And, I have done a lot of work in my career with survivors, and we go to these suicide prevention meetings, and you walk through halls, and there are quilts, with pictures of people who have died by suicide, and it's quite overwhelming to see the faces of these beautiful people who are not here anymore. And so I think of them when I sit with parents who ask me questions about this, and I try to honor the memory of people that we have lost by saying, just better safe than sorry. Just go. It might be 6 hours out of your day to sit in the emergency room. Sometimes we go to the pediatrician because we think it's strep, and it's not strep, and gosh, you were late for work that day, but it's worth it. It's worth it.
Thank you for that. Another question that we have here, how can we work to reduce the stigma around mental health?
Yeah, that's also a really good question.
I was just thinking we hadn't talked about that, and we should.
Well,
you go ahead. You go ahead. No, go for it.
Yeah, I was just going to say, that is a really good question, and we've kind of drawn these parallels between physical health and mental health, and really, let's not do that. It's health. It's all integrated. I mean, that's one of the things that, if people are familiar with the ACEs study or the Adverse Childhood Experiences study, that's one of the kind of torches from it, or messages from it, is that it's helping us to understand that it's all interconnected. I mean, we all are a whole being. And so I think that there are people out there that are, fighting this fight. We're fighting it with you. But I think the more that we can just think about it as our overall health, because it does impact each other, then that'll help us, along this path. But, I realize it's challenging. There's beliefs that are, ensconced in families, in cultures. There's a lot. So I don't certainly, want to be flippant about it, because I understand that it's challenging, and and this is why we try to get out of our clinics and get into the community and meet people where they're at, and try to talk about it in a way that people can relate and people can understand, and not just the consequences. Obviously, we're here talking about the most tragic consequence of suicide, but I think we also have to highlight the benefits and the importance of being emotionally and mentally healthy. So those are just some of my thoughts.
Mm-hmm.
Thank you. We have another question that's just come in. How concerned should I be about substance use in a child that seems like he could be depressed?
Oh, that's another topic that we haven't talked about, but I'm glad that this was raised. So first of all, in our I'm a parent of a teenager. In our teenagers, there is some normative experimentation with substances. It tends to be, for a majority of teens, not all teens, but for a majority of teens, there is some normative experimentation that happens in high school. And some research that suggests that that's not a bad thing, right? To experiment when your parents are there and they're still kissing you goodnight when they get home, and you're watching, and that can be a helpful thing. When teenagers are depressed, though, I do worry more about that, especially if what folks are experimenting with is alcohol, because we know that that's a depressant and it can further worsen mood. We also know that when we look at deaths by suicide and go back and look at what was going on for young people who have died, there often is this comorbidity between depression and alcohol use. And so that is a concern. So I again, at the risk of being a broken record, I would suggest that this concerned parent really consult with a mental health professional and take a look at what's going on with this individual young person. But I do, often when I work with teens, it's helpful not just to say don't do that, but to really dig in and talk about what's going on in their lives and what would be the barriers, what would be hard about being at a party and not using, and how could they put a workaround in place that made the likelihood of them abstaining a little bit higher. So it's really helping on those problem-solving levels.
Thank you. So the last couple of questions, Dr. Ewell Foster, you said that you were glad we touched on those. Are there any? Do either of you know of any other topics that we should perhaps touch on? We've probably got about 6 minutes left here.
Yeah, I think we touched on it, but maybe I just want to, underscore it, is to really not forget about the role that trauma can have in this discussion of depression and suicide. I'm really working with people in the community and in schools, as we talked about, when a young person is struggling to kind of think a different question. Oftentimes we look at the young person and we say, what's wrong with you? And I understand it's kind of a natural reflex. But what I'm trying to help people to do is to ask, what has happened to you? And I realize that not a bad thing has happened to all of our young people who might be experiencing depression and suicide. But more and more I am realizing that that connection is really high. And oftentimes these young people have had a traumatic experience or a traumatic event, sometimes not even known to the parent. And so I would just implore us as a society to think trauma and to consider that when we're concerned with our young people and they're showing us signs or symptoms of depression or suicide, to make sure that we're not overlooking that there may well have been a very bad thing that has happened or happened to someone that they really care about that's having an impact on them.
Thank you for that. And are there any topics you think we should touch on?
I'm so glad that you mentioned that. I guess I just want to go back to this idea that we all have a role to play, and I think that's just what I'd like to emphasize. That when I keep doing this, because I think about wellness, suicide prevention, depression prevention as a continuum of care, and all of us can do something to support. So that idea of really keeping your eyes on other people's children. We know from the connectedness literature and from resiliency literature that having adults in your life who care about you, who advocate for you, being someone that kids can talk to, being a natural helper, is a really important part of supporting our young people through their adolescence and beyond. Being a mentor, something that Polly's very passionate about. So just really thinking about how you can do something in your community, sponsor a training, reach out to kids, be that adult that's lending a hand. I think it's a really important way that we can all get involved.
Thank you. We're closing down out of time a little bit. Let's try and squeeze in one more question. Has there been any studies on links between diet and depression, and is there a natural way to beat depression, supplements, things like that?
That's a great question. It's really not my area of expertise, quite truthfully, and please interrupt me if you have.
The only thing I'll say is that we know that there can be a connection between exercise, particularly activating the cardiovascular system, and how that sometimes can help people who are struggling with depression or trying to, stave off another depressive episode. But I agree that, I would want people to be mindful of there's lots of things sometimes that aren't backed by science or backed by evidence. So I would say that if you come across things related to particular foods and things like that, and I oftentimes counsel the families that I work with to be careful about some of that and to make sure that it is based on solid science. We're going to provide a resources list because we know it can be challenging with all this information available to know what sites to go to. And so, that could be a first stop to try to look and see, are they talking about any connections for kids with nutrition and things like that. But certainly exercise can be a helpful factor, but I wouldn't say instead of, maybe in addition to.
Thank you. Thank you. And thank you both. So unfortunately we're running out of time here. We'll have to wrap up this important discussion. So a reminder, as Dr. Gipson said, we have posted a short list of helpful mental health resources for your convenience at www.mottchildren.org/webchats. That's mottchildren.org/webchats. Dr. Foster, Dr. Gipson, thank you for sharing your time and expertise with us today.
Thank you.
Yes, thank you to our audience for sharing your lunch hour with us. We hope today's chat has been helpful, and we've got a brief survey we've prepared to help us learn how we can make chats like today's more helpful as we move along, and to help us identify more topics you'd like to hear about. So if you registered in advance, you'll receive an email with the link, or you can check the comments to this video and we'll have a link there for you to follow as well. So thank you in advance for your time if you fill that survey in. And if you're interested in sharing the recording of today's chat with others, you'll find it on our Facebook page later today. You'll find it on the Michigan Medicine YouTube channel shortly thereafter. And as always, we love to hear from you on Facebook, on Twitter, on Instagram. We're at MottChildren on all three of those. That's at MottChildren. And you can also email us at mottchildren@umich.edu. So again, thank you for joining us and have a wonderful afternoon. Thank you.
Thank you.